Hello again, everybody. It's Dr. Burke with another Back to Life health tip. Today's topic is going to be shoulder problems in chiropractic. Really what it comes down to, as it always does in our office with chiropractic, is that we want to get back to the true cause of the problem instead of trying to chase symptoms and where the secondary effects are. So really what it comes down to is a neurological approach to shoulder problems. And the way the neurology works, if we look at how that goes, is that the base of the skull is the most important thing that when it comes to nerves that control, especially the positioning of the shoulder and the shoulder blade here. So what nerve that comes out of here that's most important is called the spinal accessory nerve. It's one of our cranial nerves that come out at the base of the occiput, between the atlas and the occiput there. So as that nerve gets pressure from, most likely from positioning problems, when we look at people who are at desks and computers all day long, devices especially, we put a lot of stress at the base of the skull here, and as that pressure builds up, we start getting effects that go down. Obviously, there can be injuries to the same area, whether it's a car accident, sports injuries, or whatever else. When we look at that misalignment that occurs at the base of the skull due to those things, that's called subluxation of the nerve root, and then that tends to cause the chain effect, especially in one important muscle called the levator scapula. That lifts the spinal, the scapula muscles tighten up, and then that raises the scapula, and now we've got a problem of a misaligned scapula that tends to wear and tear the shoulder. So when we look at that root, that's the first problem. Secondary to that would be the lack of range of motion that occurs from tightened muscles, whether it's the upper trapezius, the SCM, and of course that levator scapula. Now we're not getting full range of motion. Anything above 90 degrees is going to be restricted, and then that's leading to the next stage, a subacromial space problem, adhesions, fibrosis of repair, inflammation and pain. Of course, that becomes more and more shutting down as that problem progresses. So really getting to both of those problems at the same time is a true solution instead of just surgeries and permanent changes to the shoulder that really don't correct the root problem. So that's what we do in this office. We get to correcting the subluxations, then whether it's going through soft tissue work on the shoulder, massage therapists address that. We have laser, class 4 laser helps heal the adhesions and the fibrosis of repair that we talked about. So a two-pronged approach that really gets to the cause of the problem and correct the secondary effects. So stay tuned for further videos in our series. I look forward to giving you more tips.